how much is this a part of our posture these days? Or maybe when you see yourself in the mirror, you are starting to recognize, where did I get this slouch or this hunch from? Well, I mean, there are a whole bunch of reasons as individuals we can end up with, poor posture. Doesn't really matter how our posture ended up slumped. What's important is the after effects of that. Reduced ability for our lungs to properly expand, reduced ability for our diaphragm, which is our primary breathing muscle, to effectively move up and down, which has a lot to do with how blood circulates. And from the perspective of a manual osteopath, what I notice the most when people have poor posture and their diaphragm isn't functioning well is they end up with something called muscular ischemia. I know, bunch of fancy words, but really what it indicates is when your muscles start getting more tight or become more prone to ending up with trigger points and pain. A lot of that has to do primarily with circulation. We'll showcase here, our diaphragm muscle sits across here in our ribs. It is an important postural muscle that keeps our body upright, but for many types of jobs and work environments, they ended up with us being stationary, and what that does is it creates a shortness in that muscle and how it can function. The course of exercises we're going to go through now are going to broaden back out the diaphragm so that the movements of the ribs return back to healthy function. You'll find your posture of your body will return upright. So if you see yourself in a photo, you'll no longer see yourself looking kind of hunched and maybe older than you are. And most importantly is good healthy diaphragm movement provides a really important stability for our spine. So for individuals that are dealing with either neck pain, low back pain, or pain in the hips, as part of any osteopathic treatment, we always work at changing the diaphragm. The exercises we're going to go through from Aldoa are going to be specific for now improving the movements of the ribs and realigning the posture of the upper body so that all the mechanics of the spine below and above function better and with less pain and with greater ability. So the first exercises we'll address to help eliminate poor upper back posture, but to really improve how your diaphragm moves is an Aldoa exercise. As you see, we're seated on a small series of risers that are about 3 inches in thickness. On average, for most people, I suggest exactly just that. When they're starting out this exercise, sit on something that's maybe 3 to upwards of 7 inches in height and thickness. It's just much easier in the initial stages of your doing the exercises to make them accessible and comfortable for you. So, Ryan, I'll ask you to extend both your arms forward. Now in the instruction manual, this exercise will be listed as T8, T9. Turn your fingers out to the sides of the room and draw your knees just towards each other. Perfect. Again, you want your feet and legs about your hip distance apart. And then very slowly begin to extend the arms towards the ceiling. Pausing there. As we do with any of our setup, we're going to think about 10 to 12 breaths and 2 actions that you'll want to really pay close attention to as you're performing these. Pressing your feet down into your floor or to your table, extending the arms up and out on that direction, because you notice, and Ryan, you can kind of feel how everything begins to lift and stretch from this point. Because the other very important part about this region of the body is what are called the intercostal muscles. So these are small muscles that sit between individual ribs, but what they house is the highest amount of sensory fibers that speak to your nervous system about its state of wellness and being. That's why one of the most common after effects of people's performing of an Aldoa exercise is a sense of de-stress, a sense of relaxation, and a sense of ease in the body, because you're actually changing the state and tone of which your nervous system has been holding it. This, again, from a clinical perspective, I've found to be so valuable, especially for people that that are dealing with acute pain or have been in long-term chronic pain, say after a motor vehicle accident or a bad fall, or other stress events in life. This exercise people always use as a go-to for a number of rhymes and reasons. Good. Now again, like with all of our exercises in our sequence and in our system, we want to let them relax very slowly. And we'll do just that. You can feel all that heat response from that, yeah?
Yeah.
Yeah. And so on an additional note, you'll notice, as most people do, you'll get a great sense of heat or sweat response from this exercise. And that's important because of what it indicates in terms of that you're effectively accessing the region of the diaphragm and expanding its ability to move. And with that, it'll draw and create more blood circulation supply. And you'll notice quite quickly just your body generates a lot of heat from this. We'll now set up for our second exercise to help correct our upper back posture. So the position of seating will be about the same, but the angle that the arms will sit on will be slightly different. So Ryan, what I'll ask you to do is again, extend your arms straight forward. Start to bring them towards the ceiling. We'll pause there, but then you're going to open them into this wide Y position. Now, what you really want to look for when you're practicing on your home is that you have from your inside of your elbow to your ear as creating this little triangle here. And the name of this exercise, as you'll see in the static manuals, is T7, T8. This angle allows us to access a joint just underneath where we were just working. Good. Drawing the knees a little bit together, pressing the feet firm to the ground, and just holding. Big inhale, big exhale. Again, minimally trying to hold this for 90 seconds is the ideal. But again, what I've seen both as someone who uses these exercises a lot and has been a practitioner and a trainer of them, is that the initial time that you're working with these, try for 30 seconds on the first few weeks that you're working with them and build yourself up to the longer duration of holds. And we'll slowly relax the position. The third exercise to help give us better upper back posture is called our T6, T7. So you'll start with your legs crossed, palms together at the center of your chest, and keeping them together, begin to extend the arms towards the ceiling. Pausing right there. Once you get there, just two subtle actions you'll want to do. Keep pushing outwards through the elbows, perfect, and extending upwards through the arms. Now this is a really helpful exercise for correcting upper back posture and improving a number of things for the mobility of our shoulders. Good. Like with all our Aldoa exercises, we want our spine to be as flat as we can. Good. The use of the wall is very helpful for these exercises to act as a guideline. And again, once you get into the setup of the position, you're going to hold for about 90 seconds is ideal, or about 10 to 12 very deep inhales and exhales. Keep pushing down through your knees, keep extending up through the arms. Good. And then we'll slowly start to relax this exercise. Good stuff. The last cluster of exercises to help produce better upper back posture are personally some of my favorite, especially if we're either in acute or chronic pain, because of how they affect these small muscles called our intercostals. So for your home practice, you can be seated on a chair, or if you have a table, your kitchen table, I've seen many people practice them like that. You'll be seated with your legs just hanging off or fixed to the ground, but just extend your arms straight forward. Perfect. And then turn so the palms or fingertips are to the sides of the room. And then just start to curve your back backwards towards me. Opposite way. Perfect. Now, the The first level here is to lower the arms down about a half a foot, just the arms. Perfect. Hang out there. And then bring the arms so that they're almost right beside each other at the wrists. Perfect. Now, you'll notice when you're practicing at home, and Ryan can attest to this, you feel all that stretch and relief happening here. Mm-hmm. And if you were to put his hand to your back, it's just radiating heat right now. Because, I mean, for many people, we get from repetitive injuries, different types of work and job we've done, this region just gets so knotted up with irritation and discomfort that this exercise is just so valuable for helping to relieve that. But also, it houses very important clusters of nerves that will produce just healing within your body. Good. Now again, once you're holding that for about 90 seconds, you're going to move to the second angle for this exercise. So you'll keep your back in this light curved position and then bring your arms up just to your shoulder height. Perfect. Good. Keep pulling back with the fingertips. Keep rounding into me here. Perfect. Big, big breath. And you'll notice when you're practicing at home, the way to kind of visualize this is you're creating a triangle with the broad base here, the narrow base here, and then you're just going to stretch. Keep pushing the arms forward and keep pushing the back backwards. Perfect. Just those subtleties, again, you're going to feel a lot of heat response. It's going to become much easier to breathe, and you're going to be helping give yourself back good upper back posture, and that's going to improve a lot of things in the mechanics of your spine. Now for the third angle, you're just going to extend the arms up almost so that they're right beside the ears. Perfect. Good. Same thing once you get here, holding for about 90 seconds, just long, deep breathing. Good stuff. And again, referring to the instruction manual that will be attached to these videos as you need to, but we'll just relax and take apart this exercise. And that completes the cluster of exercises to help improve our upper back, to help improve the movement of our diaphragm, and to free up the intercostal muscles to produce better movement of our ribs. And you're going to notice a wide variety of improvements that happen in your quality and state of being from that. Feel free to relax when you're ready.